Number 3. And number 4 is on this side, I think, right? Are you number 4? So do you want to maybe move the microphone over this way? Yeah. Hi.
Hi, my name is Courtney Bem, and I also have some Massachusetts pride, so go Harvard.
All right.
When times get tough, as they are, I think that people in public life, people at the heads of organizations, have a huge challenge in how they talk to people about what is happening. So the communication about the situation will very often influences people's motivation, make them feel good, make them feel bad. And I think we see in the media a hunger for the bad news because it's sensational and it sells a lot of good papers. So how do you see your role in Massachusetts as a communicator about the issues that you're facing, walking that line between acknowledging what's going on and yet keeping people's eyes on the long term? And what do you see from the standpoint of the nation as a whole? How do we need to be moving in terms of that, of handling that challenge?
Yeah, what an incredibly important question, Courtney, and I'm still trying to find the answer. I think that people generally, certainly in Massachusetts, but around the country, they want their leaders to talk to them straight. They don't want the news sensationalized, but they don't want it trivialized either. So, for example, when we were making those budget cuts, there's one way I could have gone, which is a kind of classic modern politician's way of saying, we're cutting the budget and all that stuff. And but the fact is, we lay off 1,000 people. If that happens in a factory, everybody says, what a tragedy. That happens in government, people say, good. In both cases, there are mouths to feed and bills to pay. When you cut those programs, you are affecting somebody's best chance, or in some cases, only chance. And you have to call that out. You have to call that out, seems to me. And I've been trying to do that. I've also been trying to get across the point that there is opportunity at a time like this to address some issues, and this is certainly true in government, and I think it's probably true in many companies as well, that are hard to get at under other circumstances. There are a whole host of reforms. For example, in Massachusetts, we're working on transportation reform now. We have 5 or 6 different agencies, some of them government agencies, some of them quasi-public agencies, who have responsibility for different parts of the transportation network. Until 2 years ago, they didn't even talk to each other. So they don't plan and certainly execute transportation policy very well. Now, if we were to mash those all together, not to be too technical about it, we would not get enough efficiencies to pay for our transportation needs. But before we start asking the general public to contribute more in order to make to meet our transportation needs, it seems to me we ought to be able to offer a case to them that says we have got it as sharp, as tight, and as effective as we can get it. That's hard to do in the absence of a crisis. Pension reform is another one, and I'm not talking about blowing up the defined benefit system, and moving in a private sector direction. I get the private sector direction, and I also understand the public sector model. But we do have outliers. We have loopholes, and whenever they are called out, it discredits the whole thing, and it's hard to get at politically under normal circumstances. So we seize those opportunities now to try to get at it. And then the last thing I'd say is that I think it's incumbent on all of us to keep talking about where we're going, because I don't think this hunkering down is. You can't create jobs from a bunker. You can't educate kids from a bunker. You have to open the doors and look forward and do what you can and not pretend to be able to solve every problem. In the same way, I hope I'm not pretending to have the answer to every question in this room. Thank you, Courtney. Yeah.
Hi,
Hi.
my name is Chelsea,
Chelsea.
and I really like your story about your daughter because I came to America more than 30 years ago,
Yes.
broke,
Yes.
as a refugee, and my
From
daughter
where? From
from Vietnam.
From Vietnam. Oh.
Yes. And my daughter, she loves the Four Seasons Hotel, but she can't pronounce it. So she said, my favorite hotel is the Tree Hotel.
Yeah, right. Yeah.
But on a more serious note, we have a very affluent city here. And the city council just gave the police force a 30% raise, even though the city has about $15 million deficit.
Talking about Palo Alto in particular? Or?
No, not Palo Alto, but we have several affluent cities, but it's not Palo Alto. It's a smaller city than Palo Alto. If this was, let's say, Milton in your state, and you knew about it as a governor, what would you do about it if you found out about it?
Why are you trying to get me into this?
And secondly, what would you recommend the residents do about it, since we have done our best to protest and things like that? I mean, I believe that we don't sit in this kind of economy. We don't sit around for the government to do something. I think we all should do something, even from as an individual,
Yeah.
and also at the local government level.
Yeah.
And we don't wait for the state to do something or the nation, the president, to do something about it. I think that we all should be fiscally responsible. So I'm not sure if you want to answer.
Well, Chelsea, I think I know where you stand on the on the question. First of all, I'm going to purposefully avoid commenting on the example you gave, because as a lawyer and a politician and as a human being, I know there are two sides to every story, and I don't know what the other side is. I would make 2 points. First of all, I do think that government at all levels has to show in its practical behavior an appreciation and a sense of common cause with what's going on in households and in businesses. Now, that doesn't mean that there is one answer to every question that comes before government, but I do think you have to show common cause with those, and we don't always get it right. People, we're human beings too. We're going to make human-like decisions. So some of them be good and some of them less so. The other point I would make, though, is I really would just ask you, Chelsea, and everybody here, to choose your words carefully, and I say this respectfully, when you talk about government. Government is not them. It's us, all of us. And the sooner we start acting like that, the better. My own view is we get the government we deserve. And the folks who sit out and don't participate and say, I'm leaving that to the professional pals and all that stuff, you get what you deserve. One gets what one deserves. I don't mean you personally. I think what was so powerful about Barack Obama's campaign is that so many people who had checked out checked back in, or people in some cases checked in for the very first time. They were invited to see this as their campaign, and I think part of his big challenge is going to be keeping those folks engaged so that they see it's their government now too, and that they can express themselves on it, and not just by shouting into the void, but by engaging at the policy level. It's been a big challenge for us because I also believe in grassroots governing and ran a grassroots campaign. I think it's going to be a big challenge at the federal level as well. Thank you. You were 4. Number 5?
5.
Number 5, sorry.
So, Governor, my name is Jeanette Morgan. I'm
Hey.
with National Semiconductor and also an advisory member of the Commonwealth Club, Silicon Valley. Welcome to
Thank
Silicon
you.
Valley.
Thank you for having me.
And last week we were honored to have Gwen Eiffel in town,
Yes.
who recently, as you know, published a book.
I know.
entitled
I see it there.
And, of course, she talks about breakthrough leaders, Obama being one of them, and yourself. And there's a chapter devoted to you.
I know,
so I have
I
two
haven't read it.
questions. Okay, well,
Don't
first
ask
off,
me.
did you read it?
I never read stuff about me.
I did have to say it's terrific, and you are a breakthrough leader, so thank you. The second is she writes how you wrote an essay in your early years about how your grandmother should win Father of the Year award.
Grandfather, I think.
Well, she misquoted perhaps, but
Okay.
grandfather, and then ended up being should win Father of the Year.
Mm.
Given that, did that lay the foundation for your innovative thinking and laying the foundation for innovative policies such as renewables of solar and so forth? What inspiration was that for you?
Huh. Well, you know, it's interesting. I guess I better read the chapter, huh? I didn't know, boy, it's really provocative if she said I suggested my grandmother should be Father of the Year. Does it say grandmother? Yeah, I'm pretty sure it was grandfather. We weren't doing the whole cross-gender thing then. I think, you know, I had some unbelievable gifts in growing up there, even, you know, despite all the sort of material deprivations. One is that we had a very strong sense of community, because those were days when every child was under the jurisdiction of every adult on the block, right? You messed up down the street in front of Ms. Jones's, she would straighten you out as if you were hers, and then call home, so you get it 2 times. And I think those adults were trying to get across a message to us that that living in a community, being a member of a community, is seeing the stake you have in each other. That had a huge, and has a huge influence on how I think about government. It frankly has an influence about how I think about the role of businesses. I'm a capitalist. I believe in markets. I'm not a market fundamentalist. I don't think markets solve everything all on their or always get it right. But I do think that when you play, you bring responsibilities as well. In terms of innovation, I think that innovation is as much as anything about creating opportunity, and that's what it's back to that American story I'm talking about. If we don't keep, you know, we are a country uniquely, I think, resistant to stasis. We don't like to leave things. We don't like to leave well enough alone. It's not what we do. You know, we are always pushing the envelope. And when we have pushed the envelope, when we have stepped out on hope, you know, that has been the strategy behind every major step we've taken forward as a country, and it has created space for newcomers or people on the bottom to move up. And that's been true at least for 100 years, but there are examples going back even further than that. So innovation is as much as anything about social justice from my perspective, as well as our economic future. Is that responsive? No? Okay. No, Gwen sent it to me. I just haven't read it. Okay, you were number 5, right? So was number 6 over here? Yeah.
Thank you. Yes, my name is Ralph Kuiper, and much was made during the primaries last year of Massachusetts healthcare programs. Mm-hmm. And I'm wondering if you could comment a little bit on how you see that going, especially in the face of the economic downturn, and any lessons for other states or the federal government in this area.
We have had, thanks for the question, Ralph. Everybody know about our health reform initiative? We have been on a health reform journey for 2 years. The bill was signed about 3 years ago, but we started implementing it actually the day I took office. And on the coverage side, we have made enormous progress. 97% of the residents of Massachusetts are insured today, and there's no other state that can touch us in that respect. That's very, very good news. We are now working hard on the cost control side, and that was always a challenge, and it's an acute one in some ways now on account of the budget issues. Now, I will say what has been great about health reform in Massachusetts is, and the sort of untold story, is that is maybe 2 points I make. One is, we finally decided that there were other choices than the 2 we had always thought were before us beforehand, which was a choice between a perfect solution or no solution at all. So we tried something. It is not perfect. The second point I would make, which I think is enormously important and a lesson, also a lesson for states and the federal government, is that everybody was brought to the table and stayed at the table. So providers and medical industry and insurers and patient advocates and government at the state and federal level, because we needed a Medicaid waiver to make it work, came to the table, stayed at the table to make it happen, and stayed at the table for each of the milestone decisions that had to be made as we went along to adjust as we went along. And that has not always been easy, but it has been a signature element of the success of this experiment. Continuing to adjust, to make it very fact-based, to adjust in response to those facts, and to bring everybody to the table as we did so.
So, what is your vision as the leader of half of the universe, right? You know, Boston and Silicon Valley.
Just half? Is that what you said?
To change that, and especially in light of the fact that, you know, you're very close to the president, obviously, if I read the paper correctly. And then the second question is sort of more professionally related. Will you be really interested in accepting the offer if one of the slots becomes available at the Supreme Court?
Oh, man.
Thank you.
You know, you have been reading too much of that stuff in that publication. So the first question really, in some ways, comes back to, is it Andrew? To Andrew's question about the sort of appreciation of the importance of innovation among government policymakers. And I think that I can tell you that in the National Governors Association, we spend a lot of time on the importance of innovation from an economic point of view. In one form or another, really, no matter what the elements of our economy may be, of our respective economies may be, you know, whether it's farming or high tech. Innovation is on everybody's mind. So we've been talking about some ways in which we, as an organization of governors, advocate for this or that protection or loosening, as the case may be. And you can imagine in an organization with 50-plus governors, with these states and all the territories, coming to a consensus view that's sharp enough to make a difference instead of, you know, so compromise that is just kind of a hortatory expression, is an enormous challenge. I think our greatest opportunity right now is that we have a president who gets this point. And I think will make decisions and make appointments consistent with that. And he will hear individual voices, mine and others, many others, trying to make that point. And by the way, he's a really great listener, which is hugely important, I think, for effective leadership. And on the second point, no, thank you very much. I'm having a ball in this job, and I'm going to continue doing it. And if the people will have me, I'll be in the job for a second term as well. Are you number 8?
Number 8.
Okay, how are we doing for time?
That's going to be on my list.
Okay. All right, who said oh? Okay. Okay, this is, number 9 is the last one. Yeah. Are you registered to vote in Massachusetts, by the way?
I'm an ex-PU Medical Center PR person, and I never did see the Red Sox, but I have some tips for you.
Okay, all right. Okay, go ahead.
A really quick question. Avery Lightford, V Spring Capital. You talked a lot about education, you know, up through higher ed. One of the interesting challenges is, you know, most people in today's world expect at least 2, maybe more careers in their life. Mm-hmm. But you only go to school once. Mm-hmm. So how's that supposed to work? I mean, what's the mid-career retraining, and how are you thinking about that?
Avery, did you say?
Avery.
It's a really great question. 2 things that we're thinking about. First of all, and are doing. First of all, the state and the federal government provide some workforce training money, which we are trying to get to be flexible enough to respond to market changes and differences in our regions, by the way, even within the state, and to do it quickly. We've had some success with this, with the state money, but nowhere near enough, and we have had limited success with the federal money because it comes in kind of tight channels. So we're trying to get some of that relief, get some elbow room, so we can deploy that money a little bit more quickly. But the other point I would make is that we just finished something called the Readiness Project, which was an effort to articulate the next chapter in education reform in Massachusetts. It's a pre-K through higher ed and, frankly, workforce training strategy that's seamless. And in fact, I should stop saying pre-K because that's where I started. Folks are now making the point about 0 to 3 because the brain, I guess 95% of the brain develops in the first year and a little bit, and then we start spending money when they're 4, right? So how do we get the money spent earlier? Some of the initiatives, some wonderful ideas that came out of that, not all of them expensive, but the expensive ones we're going to have to do more slowly. Under the current fiscal circumstances, but we will do them. The point I'm making is that what we are driving toward is our habits of mind as distinct from necessarily skills. So by habits of mind, what is that? What are those 21st century skills? Collaboration, teamwork. So these sorts of ways of approaching problem solving that are transferable, especially in a knowledge-based economy, that are transferable from one kind of job to another. And as somebody who's had a bunch of jobs, I think they work. And more to the point, educators think they work. I mean, Jack, do you want to build on what I'm saying?
I was just thinking one of the things that we have that's kind of unique about Massachusetts is we have an online university that we started a few years ago, and it's really for career changers. And we have about 37,000 enrollees. It's actually would be our largest campus at University of Massachusetts if it were an actual campus rather than a virtual campus. And other states have that as well, but it seems to be working very well within Massachusetts to kind of help people through those career changers. And it's been growing at about 20 to 40% year on year, and it doesn't matter when you go through the down years, the up years. It just keeps growing 20 to 40%.
Avery, one last point I'd make, just back to the stimulus package, and one of the reasons for having an education component in it. At a time like this, the demand for community colleges is soaring, and so having to cut those programs because we can't afford them right now is absolutely counter to what we're trying to do to stimulate long-term economic strength. So we want the flexibility in the education spend to be able to plug some of those holes as well, so the community colleges can do that job. Thank you. Number 9.
I'm Carol Sommer. I lived in the Massachusetts area for about 13 years, and this is not a question. First of all, I want to thank you, Governor Patrick. California may have better weather, but Massachusetts definitely has a nicer, more intelligent governor. And I say that, and I don't usually like politicians. But anyway, I just wanted to give you...
Was that the faint praise part?
Yeah.
Right there?
I was born in New York. We give a compliment with one hand.
Yeah, right. I know. I'm married to a New Yorker. I know.
And I do want to congratulate you on, trying to expand health care insurance. But as someone who's been in the healthcare field, I've been in PR marketing and healthcare for about 25 years, and in health IT for the past 10. I give you 2 tips on how to cut costs in Massachusetts. A couple of years ago, I worked for a medical dictation and transcription company that was automating that system. I would suggest that you get all your physicians in Massachusetts to learn how to type and stop wasting. This country wastes literally billions of dollars on dictation and transcription that not only adds cost to every medical treatment, but delays appropriate treatment, because by the time the dictation and the report is transcribed and gotten back, the patient is already being treated. So maybe being treated for the wrong stuff.
You know what, Carol, my primary care physician has a thing, excuse me if this is not technically correct, but he has a thing that enables him to dictate into his computer.
Right.
And the computer transcribes directly on the...
It's speech recognition,
Okay.
but it
Thank
still takes a transcriber to edit that, because speech recognition is not 100% effective. But that, yes, your physician is a little bit more advanced than a lot of other
Well,
physicians.
thank you for that. I certainly hope so.
So that would be one tip that perhaps you could share with President Obama to try to cut the medical expenditures in this country.
Dictation is out. That was the one.
That if doctors would just learn how to type and put things in a computer like everybody else. And then the second tip that I have for you is that, you know, I know that Massachusetts is known for its health care. I mean, I did PR for Boston University Medical Center, and it has great physicians. I don't know if you remember, I think it was about 10, 20 years ago, the physicians in Israel went on strike, and the mortality rate went down. So, what
are you trying to say here, Carol?
And I say this, you know, as someone who represents the healthcare industry. So, and I've been in patient safety and medical errors. My other tip is there's lots of either unemployed or underemployed massage therapists in the Bay Area, because a lot of people cannot afford to go to the spa anymore. And I would say ship them to Massachusetts. I think massage therapy is a much better use of healthcare dollars.
Well, thank you. Thank you. All right. Well, I think that is that's as good a place as any to wrap it up. Thank you. Thank you, everybody. We're done? We're good.
Thank you, Governor Patrick, for addressing our group. We truly appreciate your appearance here tonight, and I don't know if they told you this, but the last two governors who have addressed the Churchill Club have ended up in the White House, so we'll just watch to see what's going to happen in that regard. As a small gesture of thanks, we will be sending you a Churchill Club t-shirt. We hope you wear it in good health.
Thank you.
And thanks again to Sean Kenny, to HP, to our partners, and to all of you for coming, and look forward to seeing you at another club meeting soon. Thank you.
Great.